Our lives are changing. CHI Health is meeting those needs. Let's imagine better health.
You can still make appointments with your pediatrician or primary care doctor, but there are 3 additional types of care to consider.
And Dr. Natalie Stuntz is going to be our guide. She's a CHI Health pediatrician. Good to see you, Doctor.
It's nice to meet you.
Nice to meet you.
Yes.
Good morning.
So we're basically talking about different levels of care here. So broadly, I guess, what's the idea? What's the concept here?
So basically, people are busier than they ever were. So we want to have lots of different options. So if you're sick in the middle of the night, what can you do versus during the day? And so we have actually, I think there's 4 or 5 different levels of care you can do. So starting from like the very least into the emergency department.
And I think as patients you wonder like, well, I don't want to go overboard if it's this or at what, and we'll go through that. We'll get really specific here with Dr. Stuntz, but at what point should we still call you as a pediatrician or still call our primary care physician?
I would say if it's during business hours, call your doctor, call your pediatrician, call your family practice doctor, and run it by them, because you'd be surprised at how many things you might think are an emergency that can be handled by your regular doctor. The good thing about that is they know your whole medical history. So when you show up there, you don't have to go back through vaccines, allergies, kind of like that bad experience you had in the past. They know that, and so you can be a little bit more tailored with your care.
Yeah, can we, this whole concept of virtual care, it's exciting, you know, because you can basically get in touch with your doctor from your home or your office, wherever you're at. How does this work? And when does virtual care make sense for patients?
Yeah, so it's the absolute most convenient thing. You can call from your couch in the middle of the night when you wake up, have a cold, something like that. But it really makes sense for kind of minor things, and maybe not so much for like little infants or babies, but like adolescents, older people. When you have something where it's pretty straightforward, you want to talk it through, you probably don't need your lungs listened to, or you don't have a cut or something that needs treated, you call in, very easy, go through some questions, and then they'll tell you if they think it's something where, you know, you really should see a doctor. I think you need a swab or a culture for something, you just get referred in at that point.
And it's really affordable.
Oh yeah,
right?
It's $10. I mean, that's it. It's a flat fee. Call in right now. Yep, and that's a temporary thing. It'll probably go up at some point in time, you would think, because that's
It's
incredible.
so much better than searching for whatever symptom online and going to that like
That's the dangerous
website
Diagnosing
and
yourself.
stop. Please don't do that. And this virtual care, it's a 24/7 thing, but this is really for minor illnesses. But I think take this number right now, jot it down, or go ahead and save it in your phone. That way, when the moment happens and you're like, oh shoot, what was it? You've got it right there on the ready. But another option through CHI is quick care, and I've done this at the Hy-Vee near the house.
Absolutely.
So at what point, Dr. Stuntz, should we look at this as an option?
This is also too for more minor illnesses. Let's say you think you have strep throat, you have a cold, you have allergies, a rash, something that you think just needs to be seen kind of quickly and treated. They have everything they need right there. Now, they don't see people under 18 months, so you'd have to do 18 months and over would go there, but it's really convenient. And then if you need anything, there's a pharmacy right there, there's supplies.
The chicken noodle soup is just a few hours away.
Who doesn't need to go to Hy-Vee every day anyway?
Yeah,
So.
those are for minor illnesses, though.
pretty
Minor injuries. What about those more serious ones?
Yes.
What do you recommend for people?
Yeah, and that's where it starts to get really confusing for some people. I think we all know what's an actual emergency, like life-threatening, but we don't always know what isn't an emergency. And so urgent care is a great option for something where if you can't get near your doctor right away and you need it treated right then and there, you can go to urgent care. So think about if you need sutures, you got a cut somewhere and you need to be sewed up. Urgent care can do that. If you think you might have a broken bone, like you have an injury or something like that, it's not obviously deformed, you can go in and kind of get that sorted out. You know, if you're vomiting, diarrhea, if you're an asthmatic and wheezing a little bit, things like that where you probably shouldn't be waiting hours or the next day to go in. Urgent care is an excellent option for that.
And then, you know, things happen in life that are even more serious than what can be handled at urgent care. So when we look at the emergency department, and this is for the longest time, as patients we felt like, well, if I can't get into my doctor, that's my only other option.
That's their first
But
stop.
when should this be your first stop?
So these are very serious, life-threatening. If you're not seen right in now, something bad could happen. So, you know, an obvious broken bone, or if like a bone is exposed, if you have a really large burn or a burn that crosses like a joint or on your face, you're having difficulty breathing. So people don't often think about that and will show up in urgent care. But if you're really working hard to breathe, you probably should be in the emergency room, especially, you know, on the extremes of life, very young or very old. If you think you're having a heart attack or a stroke, seems pretty obvious you would go. And then also, some people don't know this, but if you're an infant, like under 2 months old, and you have a fever, a lot of times there's blood work and stuff that needs to be done, so you should probably go to the emergency room for that.
Okay.
If you're having, you brought up a good point, if you're having chest pain or maybe symptoms of a stroke, I mean, there's a fine line there on when to call your doctor and when to get to the emergency room. What do you recommend?
I would say go to the emergency room, because if you're seriously thinking you're having a heart attack, you need labs, you need work, you need seen. You'd rather go there and it not be than sit in your office and waste precious moments. Then again, I am a pediatrician, so I don't see a lot of heart attacks. So for me, of course, I'm like, yes, go to the emergency room. But you know, that's one thing to remember too. Everything's triaged in the emergency room. So if you go there, you know, I'll have patients be like, gosh, my daughter was vomiting for like an hour and I sat in the ER for 4 hours and waited. That's a good thing, because they triage it. You don't want to be the patient that comes in and gets rushed right to the back, because that means
more serious stuff.
You're pretty sick. So, you know, you think emergency room, I'll be seen fast, I can swing in and out, I'll be done. But if you're not that sick, you might be waiting for hours until it's your turn.
Emergency rooms are for life-saving measures.
There you go. Yep.
So we've got family doctor, we've got virtual care, quick care, urgent care, emergency care, and that's just for starters. As Dr. Stuntz said, there's really more than this. But chihealth.com/care, there's information about all of it, because really, you know, the bottom line here is making the best choice can ultimately save you time and money. So we're glad to have you here today to spell it out for us.
And I love this whole concept of virtual care. For $10, I'm going to make up an ailment just so I can try it.
We appreciate that. Go ahead.
I've got a pain in my side from 9 to 10.
But that's true. Thanks, Doctor. We appreciate it.
Would you eat chicken for breakfast?